Hello and welcome. I'm Barkha Dutt. You're with the Mojo Story, the digital platform that does a deep dive into one big story every day. On the broadcast today, we're asking whether it's time to change the national narrative around COVID. As Maharashtra and Delhi go into versions of the lockdown, should we in fact be saying unlock? Unlock India, and what we really need to be unlocking is the vaccine rollout. We know from 2020 that lockdowns in the end are injurious to the health of nations, and they do not actually work as a sustained instrument to contain this pandemic either. So have our state governments just panicked? Do we need a new strategy to fight COVID? Lockdowns in the end only penalize the poorest Indian citizen, ravage the economy, and offer no long-term insulation against the spread of the pandemic. In the meantime, there is some good news that has come. The highest single-day coverage of vaccination has taken place in India in the last 24 hours, and shouldn't be this that our focus is on. These are the numbers we should be talking about. 4.3 million vaccine doses have been administered in the last 24 hours. That takes the total number of people who have received vaccination doses, or the total number of vaccination doses rather, to above 83 million. That is actually bigger than the population of several countries in Europe. But of course, it is still well below the number India needs to be hitting. India needs to be hitting somewhere close to 8 million vaccine doses a day. Why aren't we tracking these numbers instead of getting obsessed with how many positive cases there are and then going into variations of the lockdown across India? Let me introduce our experts on the program today, one by one. I welcome to the program Saket Tiku, who's the president of the Indian Gas Association. If you're wondering what he's doing on this program, let me tell you, it's because high flow oxygen is the one imperative need in COVID treatment. We know this now. We know it much better from last year when we used to think we needed ventilators. No, we need high flow oxygen. And Saket Tiku heads the association that looks at ensuring that high flow oxygen is provided to hospitals. Welcome, Saket. We're also welcoming to the program Anurag Katriar. Anurag is the president of the National Restaurants Association of India. In cities like Mumbai and Delhi that have imposed a night curfew, this is going to hit the restaurant business again. Not just that, Maharashtra has inexplicably stopped deliveries even of food via Zomato and Swiggy after 8 p.m. What sense does this make really any longer? We'll try and deconstruct that. We're also welcoming to the program Dr. Amit Thadhani from the Niramaya Hospital, who has been an outspoken doctor at the front lines of the COVID fight. Also welcoming back to the program Dr. Muffazal Lakdawala. Mufi helmed, ran, created the NSCI dome in Mumbai that was converted into a huge makeshift hospitals. Is that where our focus needs to be again, instead of locking down cities? I think that's what we'll be asking him. And then, of course, one of our best-known journalists, Govindraj Ethiraj, is joining us on the program as well, in particular to make sense of the data and which direction the data is actually nudging us in. Now, I want to start with the doctors first, and if I may start with you, Mufi, as someone who ran for months, devoted his life to that makeshift, gigantic facility at the NSCI Dome in Mumbai. I know last week when you were on the program, you were saying lockdowns have outlived their utility. Yet we're seeing Maharashtra in a weekend lockdown, in a night curfew. Is this just panic? Why are we doing this?
I think what the chief minister has done is out of helplessness. I think he's given umpteen warnings to people, but I think COVID appropriate behavior has not been followed by anybody and everybody out over there. People have lost fear for the COVID, and worse off, this time we've got more facilities. Like the last time we didn't have facilities, we didn't have ICU beds, we didn't have enough oxygen. Today we have everything, but we are still running out in second wave. We're running out of beds. Remember that this time the infections are happening in the high rises, in the elite class, and they want private hospital beds. So you do have jumbo facility hospital beds and ICUs available. Unfortunately, there are no ICU beds available in the private. And when your healthcare systems are overwhelmed like they are right now, I think you leave little choice to government officials but to resort to the only thing that they know of is lockdown, because that's what most government officials across the world have resorted to distance people if they're not listening.
But Mufi, when you say that people are not being COVID appropriate, yes, maybe we're not. Maybe there's a pandemic fatigue. It's a human impulse, but it also shows, in a sense, a sign of panic over pragmatism. That is what I would, in fact, argue. There have to be other ways. We know how to treat this disease better than we did last year. Why aren't we looking at all the things we learned last year?
We all have agreed that the case fatality rate in India is very, very low as compared to the rest of the world. Unfortunately, when your numbers completely spiral out of proportion, look at the growth curve. It had taken 183 days to reach the kind of numbers that we've reached in 63 days in the second wave. So when you have such a massive rise suddenly, I think most people are bound to lead to some form of panic because you are left with no choice. You have people calling you up, people saying that they would rather stay and wait for that ICU bed and not going to the war rooms at the BMC, for example, in Bombay, saying, please contact us and take the war rooms, take whichever bed is available. But people are saying, no, we want one particular hospital, one particular bed, and that's where. So if you have
that's just entitled, that's entitled elite behavior, and that is not a justification for punishing an entire state, an entire country, right, Mufi?
I completely agree that the poor people, for example, the restaurant owners, we've got the president here, they would all argue their case. But in the larger good of humanity today, if you're going to lose so many lives, I think a little sacrifice from everybody is entitled.
I'm just wondering, Dr. Thadhani, whether the direction we need to be moving in and the data we need to be obsessing about is not that steep curve, which is showing you that, of course, we crossed the 1 lakh mark a couple of days ago. We're now below that mark, hovering in the late 90,000s. Bad number, yes, but the fatality is still below 500. I'm not saying those people should be dying or those people need to die, but the fact is that we may be causing the country more danger in the long run. We have no idea what this ravaged economy is going to do to livelihoods, and it's not going to be a sustainable solution. How often can a state and a country lock down? Amit?
Yeah, so, this is exactly the problem. That it's easy to say lockdown and let people bear it, but people still have to work for their living. They still have to earn, and this is really hitting the lower strata of society very badly. They are not. It's not as if they don't know the risk involved with COVID and they are not worried about it. It's just that they have no choice, right? They aren't in a financial position not to work. So it's not right, what is happening. The lockdown should not have been announced, and moreover, the way the lockdown is announced, night curfew. I mean, does the virus not spread during the day? As a cliche, almost. It's ridiculous. And why not takeaways? I mean, okay, you could have at least let that restaurant leeway be there, that you can operate all night, you can operate 24 hours if you want, but it's all takeaway. Here you're restricting takeaways as well. I mean, what is the logic behind this? It's simply not justifiable. I don't think that it is justifiable at all.
What would you advise as a doctor?
See, the entire focus has to be on only building capacity. And let's see if the government has to, of course, hire. They have to restore the centers that were dismantled, which I think they're already doing. And equip the centers more than what they have. And the infrastructure as far as ICU beds and all is concerned is lacking. The government may be saying they have enough beds, but if only serious patients are going to be admitted, you can't do with isolation beds. The majority of beds in the BMC mega centers are also isolation beds. It's not as if they are equipped to handle bad patients.
Let me just ask Mufi before I open this up. And my question would be to you, Mufi, as someone who ran a giant makeshift hospital to treat COVID patients, what happened to that? Why did we shut them down, as Amit is suggesting? I mean, we're blaming people for not being COVID appropriate. Governments never declared the end of the pandemic. So what has happened to those centers? Why are we having to start from zero all over again?
Luckily for us, at least in Maharashtra, with these numbers, that the chief minister believed that there was a second wave around. Most people from the opposition to everybody said, shut them down. It's a waste of money. And he held back. And luckily for us, he held back because the second wave came, and it came in a huge way. So luckily, none of the jumbo centers were shut down. They're all up and running, and they're functional. Right.
So what's the problem? Why the panic?
Because people want private hospital beds. That's where the panic is. People are still clamoring for the private hospital beds. Like I told you, vis-a-vis last time round, it was completely the lower middle income group, the slum population, which was infected. Today, it's the high rises, the people who have names who are all infected this time round. And that's where the panic has gripped.
So basically, you're saying that Sachin Tendulkar and Akshay Kumar will not go like a regular citizen to the NSCI dome that you ran, but there's a moral dimension here. And before I get Anurag and Saket to weigh in on what's happening in their spaces, Govind, my issue with the lockdown has always actually been a moral one. It is, in fact, penalizing the people at the margins of our country to keep the middle class, the upper middle class, and now, as Mufi mentions, the very rich more comfortable. And we can't be, sort of creating circumstances just because the creme de la creme of our society, everybody wants a private room, a bed in a private hospital. Yes, admittedly, we'd all do that if we could. I don't want to be a hypocrite about it, but that can't be how policy is made, surely.
Right. I think, thanks for having me on your show. I think, at least speaking as someone who lives in Mumbai, it appears that those who are now landing up in hospitals are maybe slightly higher up on the socio-economic or economic strata than was the case in the first round, which is last year, and which is why the slightly differential pressure on hospital beds. But I think let's look at the two parts which can perhaps make a difference to where we are today. Lockdown, I think, has already been discussed. It's a very, very tough conundrum. Most political organizations will not want to do it because of economic reasons. And then at the same time, for political compulsions or the sheer helplessness of not doing something, will do it. So let's look at two things. I think one is vaccines. If you go back, we've always been late in involving the private sector. We were late in involving the private sector in testing for COVID-19, and that created its own problems, which is somewhat fixed now. And we were late in involving the private sector in distribution of vaccines, which again is fixed, but clearly now a little late. Now, the other part of vaccines is to do with imports and pricing. I think countries like India should allow free imports. If I want to pay 10,000 rupees for a dose, I should be able to get it and from where I want to get it legally and legitimately without having to do all kinds of other things. And that itself, I mean, that's an economics discussion, but when you have that kind of demand, that creates its supply. The second is imports, as in open up imports, allow vaccines to come in, and which of course is linked to pricing as well. And then that will create hopefully some sort of supply equilibrium, not just in India, but all over the world. The other part is to do with why did this happen? Why did everything look like it was returning to normalcy into Jan and February, and suddenly it went haywire? And the reason is really behavior. Now, maybe it's weddings, maybe it's parties, maybe it's IPL matches, but the fact is that we are not able to control our behavior, and we took things for granted.
We have election rallies happening. No one's stopping campaigning.
Exactly. So, and then you have rallies happening in eastern and southern India. And so the thing is, what can the government do today? So on the vaccines, I think I said what I feel they could do. The other thing that they can only do at this point is to focus on behavior, because this is a behavior problem at the end of the day. If I mean, we had the thali banging and the clapping and all of that at a time when perhaps in retrospect, we didn't even need it. But today we need something where we clearly convey to people that you need to behave, you need to mask yourself, you need to wash your hands, and you need to do this because either you're going to kill yourself or you're going to kill someone else. And this is, and it's not an easy one. I mean, you need to spend time, effort, money, creative ideas, and then convince the country, like you've done in past polio campaigns and so on, that this is something that we need to do with great urgency. So these are the two things that I would focus on at this point of time. And remember, lockdowns are late. I mean, this is not my original opinion, but any epidemiologist will tell you we are locking down 2 weeks into the spread of the disease, because the people who got it today contracted it 2 weeks ago.
No, in any case, my argument against lockdowns is how often are you going to lock down? It's not a feasible way to actually live. If there is panic and anxiety, it needs to be channeled into a different sort of targeted vaccination program.
So,
If Maharashtra is
one quick
accounting for
one, Barkha, I
61%
think,
of the cases, Maharashtra needs to be able to get more
correct.
vaccines.
Correct.
We can't
So,
have a
and one quick
centralized
one.
system of vaccination.
Right. And one quick one. I mean, again, I was talking to the founder of Ajivika Bureau in Udaipur. I mean, they track migrant labor. Perhaps you know them. I mean, they were saying that the threat of a lockdown has already caused, and it's happening now, has already caused labor to start going back to where they came from or did not go back from their villages after Holi. He was referring to southern Rajasthan and migrant labor coming from Gujarat. So the threat of a lockdown has already caused damage, and now we're into a lockdown in one way or the other.
And as someone who's spent much of the last year reporting on the migrant exodus, to me, it's just bizarre that we are not borrowing from the lessons of the past. We're continuing to repeat the same formula. We know things better now, right? And I will come back to the doctors on this, but I need to hear from Saket and Anurag. Saket, to you first. High flow oxygen. We almost ran short last year. There were orders given to import it. What's the status today? I know we had the notification that says the use of industrial oxygen has either been capped or restricted in Maharashtra or Gujarat. Tell us where we stand right now.
Barkha, we did speak about it the last time. The first wave, as per me, peaked on September 18, when the active cases in India were 10.17 lakhs, and in Maharashtra, the active cases at that point of time were 3.02 lakhs. From 3 lakhs, it started falling down till February 17 this year. On February 11, on February 11, cases fell down from 3 lakhs to 37,000 in Maharashtra. So from 37,000 on February 11, it took a reverse gear, and today the active cases in Maharashtra alone are 4,52,000, and in India it's 7,88,000. So I was listening to all my fellow co-panelists. I do agree with Dr. Lakdawala. Well, the lockdown, the government didn't have any other option. I remember last time when
the option is to vaccinate faster, quicker, to everybody above 18. That's the option. There is an option. We are still vaccinating below our production capacity. We are producing at 5 million doses a day. We have now hit 4.3 in the last 24 hours. It is still below our capacity. We need to be talking about ramping up production, but even at existing levels of production. But I'll come to the vaccines later. Tell me what's going on with the oxygen, Saket.
Okay. Well, now, last time also with 3 lakh cases, active cases in Maharashtra, people were saying we are not getting oxygen on time and there's a delay. Now imagine it's 4,52,000. We have limitations with the installed capacity of oxygen in the state. Now, being a part of the planning, you have every right to think the way you are thinking. When myself being part of the planning team, where I know what my installed capacity is, what is the consumption at the moment, and what is the projected consumption. I think those figures are with the CM also. He didn't have a choice. I know he didn't want the lockdown because the economy gets hit. Hit badly. But he had to save human lives, so he had to sacrifice the economy part, and he got into the.
So are we okay on oxygen right now?
Yes. Luckily, fortunately, the neighboring states like Chhattisgarh or Gujarat or barring few places, Surat or Ahmedabad in Gujarat, things are normal.
Okay.
So
you're saying for fewer active cases, we had contemplated importing oxygen last year. So how did the government have any option but to impose this lockdown? I just want to bring in Dr. Lakdawala briefly, because some of those pictures were from the NSCI dome, those oxygen cylinders. Why haven't we been able, like some things we know today? There was a move in 2020 to say, let's get ventilators. We hardly ever use ventilators now. We use high flow oxygen. We know things better. All of you, Dr. Thadhani, you all got so much better at treating this. Are we being too paranoid about constantly obsessing with the number of people testing positive? Are we focusing too little on the recovery rate, which in India remains nationally close to 93%, Mufi?
Unfortunately, Barkha, it's easier to say that we've got a 93%, but like the numbers, 4.5 lakh people, even if you're counting a 2% mortality rate, that all adds up. Remember that if it needs one person in the family to die for the family to go really crazy, this is a pandemic and we all do understand people are going to die. But unfortunately, people are dying and their numbers are increasing. Your screen just flashed 446 deaths in one day. Now, that's a big concern. There's no cure. This disease does not have a cure. We've had the remdesivirs, the tocilizumabs, the various antibody cocktails all come and go. Unfortunately, we don't have a cure. And I completely agree with you. Ramp up vaccinations. Vaccination is going to blunt this pandemic. It's never going to take it away. So the best option is we've got 0.7% of our total population received 2 doses and only 3.5% or so having received 1 dose. We've got 1.3 billion people. How are you going to vaccinate so many people? So
this is right now a disease of the cities. This is right now a disease of urban India. You need to focus on the worst hit cities. You need to cluster vaccinate. I mean, you're all experts. You don't need me to tell you this. Why are we doing a pan-India aggregated approach to vaccination? I mean, anyone, Mufi, you want to complete that? And Amit, you want to join in? And Anurag, I'll come to you right after that.
I completely agree. I think the powers that be in the center need to think differently. They cannot have a generalized approach. Maharashtra needs to be their focus area. They're saying that 10 out of the worst affected states come from here. The chief minister has already asked for vaccination to be dropped below to the age of 25. Why? Because majority of the people who are now walking around are the people between 25 to 45 years of age. So definitely, yes, you need to vaccinate them because then the deaths will come down. One thing we know across whichever vaccine you take is that the ICU admissions, the hospital, and the severity of the disease does come down. Yeah. So that's our best bang for buck, I think, with vaccinations.
Dr. Thadhani, New York is now vaccinating 16-year-olds, right? 16-year-olds. And of course, we don't know on Covaxin and Covishield how they do on teenagers, but we know Pfizer has been even sort of shown good data even for children. My point is that do you agree with what the Indian Medical Association has written to the Prime Minister today, lower the age to 25? Should at least in Maharashtra, we see this kind of universalization for all adults, at least those above 18?
Yes, I would agree with it. Because they are also quite high risk, because they are constantly moving about. Now that we've protected a large number of the, the senior citizens and high risk category, we should definitely move on to opening it up to whoever is willing, because we have seen that there is a lot of vaccine hesitancy in even.
Why can't we make it mandatory? Why can't we link vaccines with economic activity and say if you do not have proof of vaccines, you cannot do A, B, C, D? If the problem with the second wave is behavior, is it not time? I would rather have diktats on vaccines than give government sweeping powers on lockdowns. If I had to surrender liberties in some space, I'd rather surrender them on linking vaccinations with economic activity than giving, politicians so much power over whether I can step out and eat.
Correct. So that I would agree with you. But one thing I would kind of a little bit want to say, that this is not a disease of the cities as is being observed from the numbers alone. We work in rural areas. You are aware that our trust works in a lot of rural areas, and deep inside Palghar, we work in about 6 tribal villages, which are a good 4 hours away from Mumbai, very deep inside, and almost 100% of the population of these villages are running fever right now. Not a single one is getting tested. In one village where we insisted some people get tested, 6 of them tested positive. So it's not that rural areas are not hit. It's just that we don't know because they aren't coming forward and they're not getting tested. Plus, Maharashtra numbers are bad, but there is a lot of under-testing even in Maharashtra because of, it's 29% test positivity rate means there is gross under-testing. The other states are also under-testing. the other states are also under testing. Gujarat is under testing, Madhya Pradesh is under testing. A lot of under reporting is happening pan India. So, it's nice to say. I would also want, because I'm a citizen of Maharashtra, right? I would also want Maharashtra to be prioritized, because here's where I live and I'm seeing what's happening around. But the problem is not that simple, because I don't think any government would, push one state over the other. It will be
Well,
very
no, I'm
difficult.
not saying choose the states. I'm saying choose it on the basis of how widespread the cases are. And that's an interesting thought to park. I'll take it to the panel, but I just want to bring in Anurag, because Anurag's tweets have been very anguished as the head of the National Restaurants Association of India. Anurag went on Twitter and said, dear Maharashtra government, why don't you just shut down the food and beverage business? This slow death is more excruciating. Obviously, a lot of anguish in terms of what's happening to the economy. Now with Swiggy, Zomato being restricted, for, takeouts being restricted at 8 p.m. cutoff. Terrible time for your business, Anurag. And I can feel your anguish. And I'm actually not at all, despite what all the experts are trying to tell me on this panel, not at all convinced about the efficacy of lockdowns. Anurag, go ahead.
Well, first of all, I mean, this tweet was not a planned tweet. I just heard about the lockdown, and it was like a very natural thing. I was sitting on my bed and I started tweeting about it without realizing that it's gonna get viral. And it's getting viral because it's hitting the raw nerve of people.
Yeah.
Understand, from our perspective as restaurateurs, we were the first ones to be shut down in the last lockdown. We were the last ones to restart, and that was in the month of October.
Yeah.
From October, we are working till date with 50% capacities in controlled environment, and this has remained unchanged. October, November, December, Jan, the caseloads were not going up. I personally feel the caseloads have started going up because government was compelled to open up things like public transport and so many other activities. So my anguish comes from the fact that your problem lies somewhere else, but you're penalizing something because it makes for great optics to shut down malls and restaurants. There is nothing else. I mean, how do you explain, Barkha, that film shoots can go on, IPL matches can go on, construction activity can go on, people can travel on railways, people can travel on cabs, autos, but a controlled environment of a restaurant with 50% capacity is going to be spreading the virus.
Well, the doctors would tell you, so let me just say it on their behalf, that, there is enough evidence of the aerosol carrying the virus. Closed spaces are a problem, which is why even in the West, it's outdoor patios in restaurants that have opened. This is what you'll hear from the doctors. My personal argument is always going to be, this is not a sustainable way to live. Vaccinate, get proof of 2 vaccinations and open the restaurants and then hope for the best.
No,
because how long is anybody going to live like this?
If that was the case, the cases would have gone up from the time we opened in October. It would not have waited for 5 months to go up. That's my counter argument to that. But it's not a matter of argument. It's a matter of deep concern that an industry, which is a huge employer of human capital, probably the second after the agriculture in India, is suddenly one fine day you say that now you cannot run the restaurant, you can't even run the deliveries. Then what do we expect us to do? It's not a very solvent industry. We have worries. We have partners with the government. And by the way, I want to bring one thing on the table today, Barkha. 2 weeks back, when we had a meeting with the Honorable Chief Minister of Maharashtra, there was general consensus that 90% of the restaurants are following COVID protocols. Only 10% are not. And we had offered, as an NRAI, I was the one who said, we will form ward-wise team in Bombay for every 24 ward, which will report any shortcomings. And one last point on this one. There are 3 stakeholders when you are running a restaurant like this. There is government, which is making the rule. There is restaurant, the business owners, and the third stakeholder called the Janta, the people. If they are not wearing the mask, why don't you inspire them to wear your mask or follow the other COVID protocols? Because the fear of punishment is not going to inspire the masses. If you want masses to follow protocols, you need to inspire them. I
want to bring in Govind in a second, but can you tell us how much restaurants have lost this past year? We had some data, but I'm sure you have the updated figures.
Well, last year was a complete washdown. Our size before that was 4,35,000 crore annually. Last year it was, we don't have the data yet, but I reckon it is in the range of 1.45 lakh crores or thereabouts, which is 1/3 of where it was.
Yeah.
We have already had 30% of the restaurants shutting down and about 40% of the 7.3 million workforce being rendered jobless. So these are very stark numbers.
And this is where I want to bring you in, Govind. This is why I oppose lockdowns, because the point is that the number of people I met through my travels in the last year who told me that poverty will kill us before this virus does. And I don't want to make it this hackneyed life versus livelihoods debate, because the biggest difference between last year and this year is if we have something, it's called a vaccine.
Yes. So, I'm a financial journalist primarily. So, I would always argue that livelihoods need to be protected. But equally, I think a few other things need to be done. I think governments become lazy. In this case, I think it's very clear that the government, whether it's federal or states, became lazy. They took things for granted. We somehow started believing this India exception story that we are different and therefore will not get hit by the virus the same way North America or Brazil or parts of Europe have been. And therefore did not do anything. And like I said, if you want to influence behavior, it takes time. You have to build campaigns. You have to reach out. To the Prime Minister's credit, he did show himself taking a vaccine shot, and I think many other ministers and others have done it. But the fact is that it's not worked, because as one of our panelists pointed out, there is considerable vaccine hesitancy. I mean, you walk into any hospital in most parts of India today, you will find that there are enough seats to go. At any point of time, except maybe one or two cases. There are, I've seen it. About 2 or 3 weeks ago, in Mumbai city, there were 11,000 slots available on 1 weekday. Okay, this is, to be fair, this was before the 45 thing was opened up. This was last month. But I would hazard that this has not changed much. So people are not taking the vaccine. So,
but isn't this where our focus? Maybe we need to make the vaccine mandatory. Maybe it's time to say, make the vaccine compulsory.
Yeah, but
because otherwise we're not getting our lives back.
So mandatory vaccine is not an easy thing. I don't think it's easy to do anywhere in the world, because there are liberty issues here, and vaccines are it's a tricky issue. I think, but you can do it in the way that you make it a roundabout thing. You say that if you want to travel, for instance, if you want to take a flight, you need to have a vaccine. I mean, the way, let's say, the governments typically, cleverly squeeze in an Aadhaar, mandatory Aadhaar, and so on. I mean, you have to do something like that. But that clever kind of thinking, I would fully trust our bureaucrats to do if they put their minds on it.
But that's my point, right? Like I'll give you my example. I mean, I felt fine, so I never did a COVID test till I needed to, and that's when I needed to take a flight to Ladakh, where they said we won't let you in till you do an RT-PCR test. So I did an RT-PCR test. If we link enough economic activity, Saket, you said there's no other option. There is an option. Link access to travel, access to malls, access to cinema, access to sporting stadiums, to evidence of at least one jab. What's called a vaccine passport. There's an option. Saket?
I agree with you. But right now, I am only focused. Complete focus is on my oxygen stocks right now, and the way it is being consumed. I'm not looking at any other thing. I have 3 to 4 meetings. First meeting in the morning with Government of India.
Do you want to talk a little bit about that? I remember last year you really made the doctors angry because you accused them of not utilizing the oxygen optimally. And I remember, I think Dr. Thadhani was one of those programs, and they got very angry with you. What do you mean by optimum use of oxygen? Could you elaborate?
Actually, you ought to be blamed for all this, Barkha.
I have to be blamed for many things. That's fine. But carry on. Yeah.
Okay. And the government loves you as it is.
That's just fine. All good. That's how it should be for any good journalist. But Saket, no, come on, make a serious point. What do you mean by?
I did say thank you. I did say thank you to you last time, and I will again say thank you to you. In your program only, we found that a lot of my friend Dr. Thadhani was there when I said that oxygen was not being used responsibly. It was also, there were a lot of leakages happening in the pipelines. Dr. Pradeep Vyas, who's Principal Secretary Health, sent a letter to the, saying the doctors are using, high flow oxygen. It's not required. I don't know. I'm not agreeing to what Dr. Pradeep Vyas said, because I'm not a doctor, so I don't know. But one thing is there very clearly, after the letter was given, and I believe that he had to, kind of take the letter back. But he had conveyed the message to all the doctors, to all the hospitals, that more number of oxygen is being is used, is being consumed. After that letter, within 1 week of that letter, oxygen consumption went down. And how did it go down? Yes, there were leakages in the ports, there were leakages in the cylinders, there were leakages in the rusty pipelines in the government hospitals or in some other hospitals, not only in Maharashtra, but throughout the country. But in your program, thank you, we brought it to the to the notice of the people concerned, and Secretary or Extra Secretary Sumita Dauraji or Guru Prasad Mahapatraji, the Secretaries, Government of India. They did a lot of work, amazing work.
And you're still saying that, in your opinion, oxygen, we're having leakages in the oxygen supply chain.
We used to have, and then we
now
those leaks.
What's the situation now?
Situation is now the more number of cases are increasing, as I said, but it is more in Maharashtra. Last time, these 10 lakh cases were spread across the country, but yes, I think the majority was Maharashtra. But right now, out of 7.88 lakhs, 4.5 lakhs are in Maharashtra.
Yeah,
it's still going up.
I'm sure both the doctors will have things to say on this, but I because we're winding up, I want Anurag to just step in on what, I know conversations are still on with the Maharashtra government, in particular with this 8 p.m. cap on deliveries. My city here has followed suit and imposes random night curfew while keeping 24-hour vaccinations open, which means कि किसी police barricade में जाके पहले कागज दिखाइए, फिर police से लड़िए, and we're just back to an elaborate bureaucracy. Actually, what we need to be doing is losing the bureaucracy around vaccination completely, and curfews and losing the bureaucracy around vaccinations do not go together. Anurag.
Agree. No, I completely agree. And secondly, it can't be one size fits all. If Assam has very negligible number of cases, you can't have some ratio game going on with a state like Maharashtra, where the requirement is far more. If given a choice, I would advise the government of India right now, deregulate vaccination and give it to everybody in states which are very badly impacted. That's what we need to get back to lives. Otherwise, like this, we are only prolonging the death. We are killing livelihoods, we are killing lives. It's not that something is changing dramatically with this 45 years and above and stuff like that. And as you rightly said at the beginning of your program, time has come to change the narrative from counting the number of cases and deaths to number of vaccination. I went for my vaccination yesterday in Bombay at Jaslok, and it took me all of 50 minutes, including the mandatory 30-minute wait. So there are still lots of vacant slots, like Mr. Govindraj was saying. There are still lots of vacant slots. So people have to get up and go and vaccinate yourselves. That's the way to go.
And understand that there should be restrictions on what you can access if you don't have that vaccine. I know there will be moral debates around vaccine equity, but we've got to start somewhere. We can't keep philosophizing about this and as you said, prolonging the agony. Dr. Thadhani, very quickly before I get Dr. Lakdawala to come in on the last word, you said states cannot be given preferential statement, but almost everybody else on the panel believes that there has to be a specific policy vis-a-vis cases. So if Maharashtra is contributing 61% of the cases in India, for whatever the reasons, and we can keep debating, it needs to get more vaccines in the other states.
Yeah, I agree with you on that. But in person, I definitely agree with this. In fact, I had shared in the morning also that I agree with what the CM is saying. We should be allowing to vaccinate everybody above maybe 18 or 25, whatever you want. But there is, it's not likely to happen. That's all I'm trying to say.
Why not? Why do you think it's not going to happen?
Because other states are going to protest that how can you take away our quota? You know how it goes between states. Politics. It's not.
But that's my point. This is going to hit the country as a whole, and we need to understand that. Mufi, if you want to come in very quickly on 2 points. Saket's point: the doctors are not always using oxygen in an optimal way, and he got bricks for it last time also. Saath mein mujhe bhi pad gayi, and then he's blaming me. But it's a serious question. And the second point on why are we. Every day we say these are the number of cases. Why aren't we just aggressively pushing on vaccines? Do we need to, for example, dispense with the bridging trials that the government has asked for Pfizer, for Sputnik, for J&J, and allow emergency authorization at once, like we did for Covaxin?
One thing I like to say, Barkha, is that all of us will never be safe. We will never be safe until all of us are safe. Yeah, that is what we need to get. So let's get this interstate rivalry out. The virus does not decide to cut off on Maharashtra-Gujarat border or Maharashtra-Madhya Pradesh border. It's a virus. It will go. It depends on the number of tests you do in a particular state. That's why you're not picking up those many positives. People are crossing over borders. The other thing is, as far as oxygenation, both of us have argued with lots of people on this, that oxygen is a lifesaver in this disease as compared to any other respiratory disease. Yeah. So oxygen should not be wasted. I completely agree that we need to use every single liter of oxygen, every single kg of oxygen, whichever way you want to put it, to maximum use, because that's the only savior that we have with this disease. I think what you've correctly said and what everybody on this panel has said, let's open up vaccinations. We do know that Maharashtra accounts for 60% of the vaccinations. We do 3 lakh vaccinations today. The health authorities, the CM has said we are capable of doing up to 8 lakh vaccinations in a day. Why not give it to them? And they are ready to do it. Let's save more lives. We do know that 60% of the case infections are in Maharashtra. Let's open it up for them and let's see how they go from there on. I think that for the restaurant, the Swiggy guys, the guys who deliver the foods, I think they should be counted as frontline workers and vaccinate them. So people will get away with the fear of leaving their food outside before taking it inside and all. So I think all these things are needed to be looked at by the government seriously now, whilst we're in the middle of the second wave.
And I think that's a great point. The delivery boys, they did human service even at the height of a very, very draconian lockdown all of last year. They are essential services. They are frontline workers. They need to be able to access those vaccines. It would also help the economy at a time when the restaurants are being forced into closure. So we need a more integrated approach, and that remains my reservation about these lockdowns. Despite these case figures, I think we need a new narrative, new strategy to fight COVID. But we'll have to leave it there. Thank you, all of you, Saket, Govind, Mufi, Anurag, and Amit. Thank you for your time, and to our audience, see you tomorrow, same time, same place. Thank you for watching. Bye-bye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.